We found that patients with inflammatory bowel disease have poor sleep. We're not quite sure why that occurs, but there appears to be a bi-directional relationship between sleep and disease activity, meaning that disease activity perpetuates poor sleep, but poor sleep also worsens disease activity to a certain degree. We found also that patients who are minorities tend to have poor sleep, but there have been no really good studies looking at basically sleep patterns and both objective and subjective findings of sleep in patients with the minorities with inflammatory bowel disease compared with non-minorities with inflammatory bowel disease. So there have been some data suggesting that minorities have poor sleep patterns, and this may be a reason why there's such disparities in health status among some minorities versus non-minorities in our patients. So after controlling for disease activity, certain medications, we found that minority status was significantly associated with with objective parameters of poor sleep, as measured by a wrist actigraph, meaning that patients that were minorities, mainly African Americans or blacks, and non-Caucasian Hispanics, had poor sleep, had more fragmented sleep, and basically were waking up more often than Caucasians who had IBD. Interestingly, their subjective patterns were not different. So we only found that this was only true for the objective measurements of sleep on wrist actigraphy. Suggesting that probably the surveys that we use often in clinic are probably not capturing the sleep patterns of our patients with IBD, which is something that's also been discussed in the past. So I think the biggest lesson learned is that in many ways minorities have been sort of describing, in many minorities with IBD have suggested that they often have a poor disease course. Studies have suggested, however, that the main areas where we're finding these sort of poor disease course indices are usually in the subjective indices of disease activity on Harvey-Bradshaw index. So there may be a concern that we're not appropriately addressing complaints or questions regarding sleep, depression, psychosocial issues in our minority patients with inflammatory bowel disease, and that having a culturally centered and actually a centered approach for these patients is something that moving forward will be very important. More importantly, I think it may suggest that poor sleep is universal in our inflammatory bowel disease patients, and that addressing this key component of their psychosocial issues would be helpful in sort of not only promoting good health in terms of IBD, but general wellness and being.